thank you so much for inviting us. I'm representing my team, the Human Development Program at AKU, and I'd like to thank the organizers and Madam Chairperson for this conference, for this session as well. We've learned a lot, and I'm certainly learning a lot, and we have all a lot of collective learning to do together. I've been asked to specifically talk about the flood support and the flood relief that AKU was part of, and the challenges that we faced, and I'm going to run you through that journey. And I'm the first to admit that providing ECD care during that emergency was probably the most challenging, and we probably fell short of our goals, and we probably could have done a much better job. But I think I speak for a lot of people that in that kind of crisis and stress, we all try our best. So I'll just run you through that journey. Our chancellor has made it very clear at the outset that we have to be socially relevant, whatever work we do. And I think all of you, all of the experts, all of the people in the audience know that very well, and you've chosen ECD as your calling because it is one of the most socially relevant investments in time and effort. When the floods hit us and it was an emergency situation, the whole nation responded. I think that's one of the heartening things about Pakistan, that we run from one emergency to the other. So the state of emergency thus is constant. And that is the biggest challenge, that how do you keep your eye on one emergency while the other one rears its ugly head. And I think I would say that a mother lives her entire life like that. She's running from one emergency to the other, one child's needs and then another child's needs and the family's needs and and society's needs and her own needs, which come last. So I think we have to say that Pakistanis, and especially Pakistani mothers, are very good at dealing with emergencies like that, and we must acknowledge their efforts, because it is through their efforts that our nation stands despite all the challenges we faced. So I'll talk a little bit about some statistics of the floods and run you through a pictorial of all that was done, and talk a little bit about what can be done in the future and what we all can do better. So this is a map of Pakistan that shows the areas that were affected, and all of you know this was a very heavily populated area in Pakistan, and across all the provinces the devastating effects were felt. We know, and these statistics probably are an underestimate, but at least 33 million people were directly involved, 16 million children, maybe 750,000 pregnant women, and potentially more. The lives lost for the adults and the children probably again are underestimated, because these were again in the immediate aftermath and don't account for all the disease and the deprivation that happened after, which was quite a long time and still plays out in front of us. Lots of schools and homes damaged, as you know. And if you look at the monetary cost of it, right? So $15 billion in damages and $15 billion in economic losses. It's just mind-boggling, and now we're facing the worst economic crisis of our history. So really, a very, very terrible situation for how to move forward. The worst hit, obviously, were the mothers and the children in the society. And we know that malnutrition, which was the immediate fallout from the floods, hits this sector of the most vulnerable population. The pregnant and lactating women suffered a lot, and a lot of interventions were targeted towards this group as well. The poor sanitation and all of the other challenges that came with it came with a lot of diseases that made it very, very challenging, that even if you provided the nutrition, you needed to actually provide medical care along with it to deal with that disease and so forth. Routine immunizations, which we always are struggling with, were further hampered. So you can kind of really tell that in the background of a large emergency, we had a new emergency that did us in. And on top of all of that, on top of all of the things that immediately can be seen by the naked eye, was the underlying cognitive and social and emotional deprivation that still happens today. And I think that is sort of the unseen, end of the pandemic, or as they call it, the end of the iceberg below the surface that you have to really, really dig down deep to see. This was, just a few pictures that our team was able to take. You've seen lots of images, lots of videos. Nothing is enough. I think people on the ground can, attest to the devastation that happened. And, the good thing was, though, just like when the earthquake hit us in 2005, people responded, whether it was through, ground transport, through personal transport, through animal transport. People tried to get to the areas, tried to provide aid as much as possible. This was part of AKU's response, and I think we touched just a few districts. But the good thing was there was partnership, there was coordination. A lot of NGOs, a lot of organizations were working together to make things happen. Our main footprint in the relief efforts was in Sindh and KP, but we did have some presence in Balochistan and Punjab as well. The key services were mainly centered around health. And you can see, because we that was the immediate need. A lot of the interruption that happened needed to be targeted and so forth, and tried to support the women, especially in the mothers, so that they could take better care of their children and their families. A lot of health camps were set up. You've seen lots of images like this, and when disaster strikes, this is what people do. But specifically with regards to ECD efforts and so forth, again, I think we fell short. We need to do a lot more. You can see, primarily women were seen at these camps. Women brought their children. They were responsible for the healthcare needs of the family. So we provided support to them to make sure that we took care of all their health needs. Most of our healthcare providers were women as well, so that was very much needed in the field, as all of you know. And by this effort, at least the interruption in healthcare that was done was prevented, as much as possible. We also felt that capacity development of healthcare providers in this, disaster relief effort was very much needed, because, this needs to be taught. This is typically not taught in medical schools. This is not, taught formally in residency programs, for example. So a lot of efforts were done to train people so that they could respond. But like I said, specific training from an ECD perspective probably didn't happen, and we didn't have enough people with ECD background to provide those needs, and I think that's really what's needed. We had our nursing school colleagues help us because they had some background in capacity building, etc., and so forth, in the maternal and child health sphere, and we used their efforts, and we actually provided a nationwide online masterclass in disaster relief for people who needed it. The AKDN and the entire, Aga Khan network was mobilized when this happened. A lot of fundraising happened abroad to help Pakistan, and we're proud to say that, a lot of donations were collected in that initial effort. The Aga Khan Agency for Habitat provided the initial shelters in various areas of the country, and so, the whole team was brought together. But like I said, from an ECD perspective, we needed to rethink our efforts and rethink our strategy. So what needs to be done? So I think that nurturing care framework that UNICEF has developed and has been very clearly stated out needs to actually be implemented and played out. And for that, we need people in the field, people qualified to do this. I'm preaching to the choir when I say why is it important. So I think it's clearly there, and speakers before me have spoken about this. I think we've recognized this, but when it comes to implementation, I think we're still, stuck in the medical needs, and I think we provide a little bit of psychosocial support, but specific ECD targeted interventions are not happening, and I think that's what really, really needs to happen. So I think this forum together can actually lay out how it can be done. I think the why doesn't even need to be discussed anymore. It's really now the how, and then how do you sustain it? That's really the most important thing. We've learned a lot, and I think we can actually tell other parts of the world how to do the medical part of the relief, but I think we need to put our heads together on how to really focus our efforts on ECD and really make those interventions available to our people in disaster areas. So I think if ECD can be sort of integrated into disaster relief, so whether it's an earthquake, whether it's a flood, whether it's any a form of natural, or as Dr. Shazia said, man-made disaster that befalls us, I think we must not forget ECD. I think that's really where we need to go with this, that the immediate mobilization of house officers, medical students, junior staff is all there, and they're all there, but what have we taught them about ECD? What do they know? What do our lady health workers know about ECD? What do our immunization workers know about ECD? I think that's what we can do. If ECD becomes just as important as the polio drops, I think that's where we'll start making a dent. So I think that's the language that we need to really, really get out to people, that, all of these nationwide campaigns for whatever issue people comes up, ECD is front and center. It is the best investment that one can make. And I think the health sector, the education sector needs to work together. It's not only a health issue, it's not only an education issue. Our children deserve, the all-round care, and that's what we need to give them. So with that, I think, like I said, I am not personally from an ECD background, but I have learned a tremendous amount from all of you. And all of you are people who've grown up in Pakistan, who've helped the nation get to where it is. So I think we look to you. Everyone in their own position is there to support you. Let's make ECD the most important thing that we do. Thank you very much. And any questions? Thank you.